Good morning. We're glad that you're able to be with us today to tune in and get the latest update on the way that the coronavirus, COVID-19, how it's affecting our community here in Lebanon and Laclede County. We have brought together Charlotte Baker, and we have some other of our elected officials that are going to be here today. And so this is definitely something you're going to want to stay tuned to. Please share this so that our friends and family can get the right information. And no one has asked me to say this, but I just kind of saw a few things this morning. Please, if it is not a confirmed case, don't share with people that you have this virus unless you've been diagnosed with this virus. Take appropriate precautions, but we don't need to continue to stir up any more fear in our community. Let's let the doctors, our medical professionals are fantastic. Let's let them guide us in this, but we don't need to store up any more fear or panic. But we're going to start this morning with a word of prayer, and then I'm going to have Charlotte come and speak to us. Let's pray. Heavenly Father, Lord, these are unprecedented times for all of us. We thank you so much, Lord, for your provision. God, the protection you've given us, the wonderful people that we have in place, Lord, in our hospitals, in our necessary businesses and retail stores, God, our restaurants, Lord. I pray your blessing and protection upon all of us. And God, particularly for the lady that's about to come up here, Charlotte, and her staff, Lord, I thank you for their tireless work and the way that you've kept them going and kept them healthy. Lord, please continue to protect them. Be with Laclede County this morning, today, and throughout this epidemic. And God, help us to turn our hearts back to you. So, Lord, give us clear eyes and help us to see exactly what we need to see, Lord, to make the best decisions for our families. Thank you, Lord. In your name we pray. Amen. Charlotte Baker.
Good morning, everyone. We certainly appreciate everyone who is able to tune in to us this morning. For those that are new, we have been doing these briefing sessions ever since the last part of February, and today's session is a little bit different. We have been meeting face-to-face over at the Office of Emergency Management, and obviously we are trying to comply with the order that we have put into place for no more than 10 individuals gathering. So we are greatly appreciative of LifePoint Church giving us this opportunity to still come together and do our briefing session, and likewise to bring members of our public into the session as well. So we do thank you for that very much. The information that will be shared with you today comes from a number of sources. It comes from the Centers for Disease Control and Prevention, the Missouri Department of Health and Senior Services, and likewise our agency, the Laclede County Health Department. The numbers and counts included today are those provided by those agencies, and we do try to provide the most updated information as possible. Okay. So in the beginning, when we did our first briefing session, there were 42 countries reporting confirmed cases of the COVID-19. This is what the global map looked like at that time. As of yesterday at 12 noon, this is how the COVID illness had spread, now affecting 165 countries that were reporting. During our first meeting that we had 42 countries reporting. So you can certainly see from this slide the advancement of the illness. Now, the United States progression of the illness is what we'll look at next. As the illness spread into the United States, we first saw that we had 8 states that were working with cases, whether they were cases of their residents or they were states that actually had taken repatriated cases back into their area. So we originally had 8 states. The next map that will come up is where we are currently today. We have now all 50 states, including the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands that have reported cases in their specific jurisdictions. The graph that you see that just came up on the slide, that graph shows the number of cases. The lightest color states have states that are reporting anywhere from 6 to 50 cases, and the darker colored states are 5,000 or more cases. And just as an example, our top 3 states in the United States right now being New York with a total of 26,358 cases. California is next with 2,500, and Washington tops our top 3 with 2,469. And again, these numbers are up-to-date numbers as of noon yesterday. So in Missouri, the statistics that we now know in Missouri are reporting that is being done. We're learning about Missouri cases anywhere from around 2:30 to 3 p.m. each day. And as of yesterday, Missouri has had a total of 356 cases. We've had 8 deaths, and this is 39 of the 114 counties and 1 independent city reporting cases. So that's a snapshot of where we are for the state as a whole. Another thing that we would like our community to know is that the Missouri disease counts by age, and that'll be our next slide. Watching the COVID-19 illness as it was in the early stages in China and Italy, we saw that the disease was affecting the older population, those individuals who were 60 to 65 plus years of age, and then likewise those individuals with underlying health conditions such as diabetes, chronic heart disease, chronic lung disease, liver and kidney disease, and anyone with a compromised immune system. So in the beginning, that's what we were seeing this disease affect, who it was affecting most. However, as you can see by the numbers there in Missouri, things in Missouri are a little bit different that we're finding. We are seeing a significantly high number in our age 20 to 29 and 50 to 59 age range. This is particularly concerning for us for a number of reasons. One being the college and university students are obviously in that age range, and I think that's certainly why the universities and colleges made the early, quick decisions to shut down their campuses. Likewise, especially in the 20 to 29 age range, that's a lot of our young families and young families with children, so that's concerning for us. We also have a concern for our young women who are pregnant in that age range. That is one of the concerns I know that our healthcare providers are having, and likewise we provide the WIC program through the health department, and that's one of the areas of concern there. Likewise, and probably a huge concern for us is from that 20 even on up to the 50 to 59 age range. That's the large majority of our workforce. And so seeing these numbers in the state of Missouri is definitely a concern for public health officials and our community officials. We are also finding that the high number, as you can see on the slide there, from 20 to 29 in the state of Missouri, we have had 73 individuals test positive. We are finding and hearing reports that that age group is one of the age groups that maybe isn't practicing the social distancing as well as they should be. So we're seeing really high numbers in that group. So what's happening in Laclede County? As of this morning, the total number of Laclede County residents that have been tested, we are currently at 14. 6 of those have been negative. As of right now, prior to coming over to the briefing session this morning, we still have 0 confirmed, but we are waiting 8 pending tests. These numbers are changing rapidly. Yesterday was a very busy day for us at the health department, getting new reports in of testing being done. So those numbers are changing very, very rapidly. We've had many questions, and most of them are focused around why is it taking so long to get test results. And I want to assure you that the healthcare providers and your public health officials, that is our most frustrating concern with this illness, is that we can't get the test results back quick enough. We know that our state public health lab is doing tests, commercial labs is doing tests. We even learned this morning of a private lab that has now been approved. So there's lots of testing going on. We need and we want those test results as quickly as possible. So just please know that we share in your frustration. We do have county residents, as you can see, being tested, and we will continue to have more be tested and those results come in. We want to talk about some of the disease specifics next. If you're new to us and have not been able to participate in some of the briefing sessions, you may not have heard these, so we do want to share this with you. So first of all, the signs and symptoms of the disease. Originally, it was thought that all individuals would have a fever, and the guidance that we're getting now tells us that most will have a fever, but the signs and symptoms are fever, cough, and shortness of breath. The incubation period, we are told, can last anywhere from 2 up to 14 days after exposure, so that's your incubation period. The illness severity. The illness severity can range anywhere from mild to severe. We are hearing of cases from individuals that have very, very minimal symptoms, maybe a fever, a slight cough. There's been even reports through our news media that some individuals that tested positive said, I really didn't have a very severe case and I didn't know. But then on the other side of it, there are individuals that have very, very severe symptoms and require hospitalization and even the mechanical ventilation services. We do know that the disease is rapidly spreading. In the beginning, many of the cases were travel related. We do know then that progressed to person, and now we have thousands of cases that are considered unknown source. And so we know that this disease is changing as far as the spread, and it's happening rapidly. Laboratory testing, I talked about that a little earlier, but again, the Centers for Disease Control, our state public health lab, and commercial labs are able to do that. A test is provided and taken by our healthcare providers. It's a nasal or a nose swab, and those specimens are then what is sent off for testing. The activities at the local health department, I'd like to share what we are doing within your Laclede County Health Department. The first thing, we are working with our healthcare providers for the COVID-19 testing needs and guidance. We are assisting with the state public health lab kits. We are able to get those and get those transferred to our healthcare providers for testing. We are providing up-to-date testing guidelines. We did have the guidelines sent to us earlier in the week that were less restrictive than what they had been originally. So that is a good thing. That is enabling our healthcare providers to hopefully get more people tested through the state public health lab with quicker turnaround times. Likewise, we are assisting our healthcare providers with courier services, getting those specimens sent up to the state public health lab. We are also monitoring PUIs, or persons under investigation, for home quarantine. These are individuals who have tests pending, and we are monitoring them daily, checking temperatures, checking for symptoms, and just make sure that they are following home quarantine. We're participating in daily and weekly conference calls. Those are calls coming from our governor's office and from Missouri Department of Health and Senior Services, and we're participating in those on a very routine basis. We are also providing up-to-date information on our Facebook page. This is very important to us because we are trying to work extremely hard to provide accurate and timely information. This situation is evolving and changing very, very quickly. And I even hear myself personally, I hear reports on the radio, and I'm hearing different numbers and different information than what we are seeing. But I do want our county residents to just understand that we are trying to provide the most updated, accurate information, and we're doing that on our Facebook page because we know we are able to link that with other community partners and get that word out as much and as wide as possible. We are conducting briefing sessions, just like what we're doing today. I think this is maybe the 6th or 7th briefing session that we had done in our community, and so we're trying to certainly get information out on a wide variety of sources. So we do appreciate you tuning in and learning more today. We are literally fielding hundreds of calls and emails, text messages. They're coming in just a wide variety of ways, and we are trying to respond to each and every question that we get, and we do appreciate your patience, as some of the questions we don't have readily answers to, but we do try to find those and get back with you. So we are just trying to provide as much information as possible. We are assisting our community emergency preparedness partners with available PPE. Personal protective equipment is hard to come by at this point, but we are trying to do everything that we can to make sure they have what they need and assisting with them as much as possible. We also are issuing orders. For example, the order that was issued last Friday on the 20th of no gatherings of more than 10 people and social distancing requirements. So we are doing that. We will also be assessing future orders and future needs, and we will be issuing those as needed. We also will, once we receive our first positive case, what will happen in that situation is when we receive our first notification that we have a positive Laclede County case, we start mandatory investigations, learning as much as we can about that individual, who their close contacts are, and then we will also start working with those close contacts for monitoring, and then also needed quarantine and isolation mandates will begin at that time. Now we have some recommendations for our county residents. First and foremost, and this has been a recommendation since we started monitoring this illness, washing your hands thoroughly and often is one of the very best protections that you can do for yourself and your family. It's very simple, but it's very effective as well. So please wash your hands thoroughly, wash them often, and do that just as much as you possibly can. We also recommend cleaning and sanitizing of your home and your businesses. You can do that, and that can help eliminate the spread of this illness and other diseases as well. So we do encourage that in your home and your businesses. If you have a mild fever or a cough, these are symptoms of the illness that can be managed at home. We would encourage you that if you have questions, you can call your healthcare provider and try to seek other guidance. But if you are experiencing just a mild fever and a cough, again, those are things that you can manage at home. We know that our healthcare providers and our emergency departments are very, very busy, and we do ask that you not overwhelm them even more than what they already are, and if you have mild symptoms, do try to manage those, and if you do have questions, your healthcare provider is more than willing to answer those, but we do just try to ask that you do that at home if you can. If you are experiencing shortness of breath, one of the more severe symptoms of this illness, that is a time that you are needing to seek additional medical care. So again, if that is occurring, contact your healthcare provider, see what they would direct you to do, but that is a symptom that is showing that the illness is progressing and is getting more severe, so please seek medical attention with that. The decisions that you make will either help our community or it'll hinder our community, and it will either help stop this disease or continue the spread of it. So we are asking all of our Laclede County residents, if at all possible, please stay at home. Now is not the time to be visiting with people, to be gathering together, taking your children to the playground or parks, or doing non-essential activities. Now is the time for you to be doing everything you can to help us stop the spread of this illness into our county. Likewise, the decisions we are having to make are being done to provide as much protection for our community as possible. We will continue to make these decisions. They are hard decisions, but they need to be made, and we will be continuing to do those. We also want to provide you with a source of some information for additional information. The CDC website, www.cdc.gov, is one of the most excellent sources of information that you can go to. Again, much of the information provided today we receive from CDC, and so that is just a great resource for you. Missouri Department of Health and Senior Services likewise has a great website. It's health.mo.gov/coronavirus. You can go to that website. There's frequently asked questions, just a multitude of information that you'll be able to locate there that will help you and guide you, not only for individuals but also for businesses, schools, and lots of different industries. Missouri also has a 24-hour hotline that you can call. You can ask lots of different questions. They have healthcare providers that are manning that hotline, and so that number is 877-435-8411, and it is answered 24 hours. Likewise, you can also call the Laclede County Health Department. Our number is 532-2134. We are happy to try to answer as many questions as we can. And again, if we don't have the answer readily available, we are making every effort to find that answer. We also are posting information on our Facebook page, trying to keep that as accurate and as up to date as possible. We do have a website for the health department, but we are finding that information is changing on such a rapid basis. It is very difficult to keep both our Facebook page and the website up to date, so we have chosen to do all of our updates through our Facebook page. So we would certainly direct you to that as well. The next slide, my final slide, is a question and answer, and I know I don't have a crowd of people today as we usually have, but I do know that you do have the opportunity to put questions in as the live stream is occurring. We have staff back at the health department that is trying to field those questions and find answers for you, so we're doing that. I also know the city of Lebanon is doing that as well. They have a staff back that is looking at questions that you have that may be directed towards the city. They're trying to provide those answers as well. Even after the live stream is over, we will continue to work to try to make sure the questions are answered. And at this time, I think I'm turning the mic over to Mayor Carr. Is that correct?
Good morning, and I just want to commend and thank the Laclede County Health Department and Charlotte and all the work that she does for this community, and really lays it out there. And what the city is doing is listening directly to her and to her staff's recommendations on what people should do and what you should do to help alleviate and help make this the best situation in Lebanon. And we are working directly with her office and working towards getting the right information to the right people, and as to duplicating her message to as many people as we can. And I do appreciate all of your hard work on this and many tireless efforts that you have put into making sure that this community stays a safe place. I just want to reiterate that we are working on all of this together and as a community, and reassure everyone in the community that this is very unique and very, I don't think anybody's ever been in this position before as mayors of Lebanon or governor of Missouri or even president of the United States. Nobody has ever experienced anything like this. And so it's very trying, very taxing on all of our systems, and we appreciate everybody's patience and looking out for your fellow neighbor is really what this is all about, and working together as a community to do what we can to stop the spread of this virus, as well as being mindful of what we're going to do in the future to alleviate any problems that we may arise. As Charlotte mentioned, we do have staff back at City Hall right now that will be happy to answer any of the questions that you guys may have, and we will continue to monitor that and get out the information as soon as we have any information. It is posted on our city Facebook page, so I would encourage everybody to monitor that, as well as the Leclerc County Health Department. I don't have anything else besides that at this time, but I do appreciate everybody's input, and we're going to continue to work on this together, and I think we're going to come out on the other side of this. Lebanon Strong has been our motto, and I think that this community has done so much for and working together, and it's been a true blessing to be able to see that this community come together, and so proud of our community. So thank you. And now I'll bring up Commissioner Randy Angst.
Good morning. What I would like to communicate from the county standpoint is that we're constantly monitoring the information we receive from the federal government, the state government, but more importantly, probably from our local government. And I can only add my gratitude to Charla and her staff for everything they're doing to keep this community safe and keep us informed. Also, I'd like everyone to know there's a great deal of cooperation among all the stakeholders here, whether it's city, county, health department, our first responders, OEM. It's truly a team effort that's taking place right now, and I can assure you we're all working together to communicate what the facts are. The other thing I would like to mention is that as a small business owner in the community, this has made me realize something. I'm more determined today than ever before to make sure that there's a path forward. And I'm encouraging all the small business owners out there in our community who are struggling right now, perhaps to use the most creative methods they can, and I see a lot of those on Facebook. And I just want everyone to know that this is a great community. We can all work together. We are working together, and we're going to come out on the other side of this stronger than what we are today. So now's the time to really reach deep inside of you, do what you need to do, take that personal responsibility. And I think that is something that needs to be stressed. We hear what we need to do, but are we doing what we need to do? So take that very seriously. And at this time, who is the next speaker? Sheriff Millsap, you want to give us an update on anything at the other end of the courthouse?
Good morning. I'll just make a couple of quick remarks, and first of all to Charlotte Baker and the department of our local health department. You have no idea what a great job that they are doing, and what a resource she's been for most of us that have had questions and concerns. I will tell you, on the first responder side of things, certainly at the county level, and I think I can speak for the police department, it's pretty much business as usual, and I think that's what our citizens want. We still have to enforce the law. We still have to investigate cases. We're still going to calls. Our staffs have all been briefed on things that we should and should not be doing in trying to deal with this, make sure that we're not helping spread the virus, but yet doing the work that we need to be done. So we'll continue that. That's part of what we do. I know the same for those in at the hospital and for those in EMS and fire and OEM. It's we have to go out there and do our work and to keep citizens safe, and we're doing that. And again, the cooperation between the city and the county, certainly at the law enforcement level, has never been better, and we'll just continue to work and follow the recommendations of our local health department and the state. That's all I have.
All right, so again, we just thank you all for tuning in. We hope that through the information that each one of us shared today, we help to answer some of your questions, help you to know what is going on here within Laclede County, within Lebanon, and our outlying towns and cities. We will continue to work hard to protect the citizens of our county. We are going to meet after the live stream is over to discuss some further things that we need to do for our community, and just know that your protection is our utmost priority. So again, thank you LifePoint for giving us this opportunity, and we will be doing this again next week, and you're welcome to tune in as well. Thank you, everyone.